So India is really a country of extremes. With climate change, we're starting to see more and more extremes, both extreme drought and extreme precipitation. Increased monsoons are very dangerous for vulnerable populations in Bombay because the most vulnerable populations live in the low-lying areas. These are the ones that are in the flood zone, and they typically are the lowest value areas that are many of the slum communities where HMS is working. So at HMS, one of the things we're trying to do is work with these communities in Mumbai and Hubli to increase their access to water and increase their access to clean water even when the situation isn't necessarily so. We are developing basically a low-cost, high-quality filter that is going to be used for slum families. We're trying to keep the cost between $5 and $10 so that people can actually afford it and they can have safe water to drink.
The project was started in 2004 by a PhD student from Berkeley who was traveling through India and was working with the group Committee for the Right to Housing. And they recognized that water was a major concern for them. And so they asked if there was anything that could be done. She brought it back to students here at the Berkeley Chapter of Engineers for a Sustainable World. And this is just a type of project that students take on.
She gave a talk and I was one of the first students who came up after the talk and said, "This sounds like an amazing project. Let's do this."
This is the current HMS unit design. After the water goes through pre-filter, we ask users to drop in a couple drops of chlorine into the top chamber. The water will go through this physical filter, which will remove the things that the chlorine doesn't kill. The bottom chamber is meant for safe water storage, and we found in some cases some households will have more contamination in the storage containers in their homes than they do in the tap where they first collect their water. And we included safe water storage in our design so that people don't have access to the water and can't stick their hands in or dip cups in and recontaminate the water in any sort of way.
In the communities, about half the users added their chlorine regularly at the correct dosage as they used the filter prototypes, and the other half forgot to use the chlorine or ran out and didn't buy more. And so what Justin and Andrea and the rest of the Haath Sehat technology team is working on right now are different solutions to integrate filtration and disinfection.
What has been realized since is that technology is not enough. You need an education program that can partner with the technology to teach topics like safe water storage or hand washing or transmission of disease.
So the reason for our education program is to explain the germ theory and the fecal-oral route. I think what's key to remember here is that people that live in these situations where, there's open trench sewers, there's lots of flies, people are going out into the fields because they don't have bathrooms, there's no access to clean drinking water. In these situations, people become used to it, and so a lot of times it becomes normal to them and they don't have the motivation in order to do something.
Initially, when the students from Berkeley got involved, we would go to the communities and we'd work through CRH and we'd work through a translator and we'd, do these workshops. But it kind of really wasn't sustainable. And so what we decided to do was involve local students. So we went to colleges and the students really ran with it.
I mean, for us, it's like a totally new experience with HMS. For me, personally, I'm so sure that if not for HMS, I would not have been doing this kind of work, which I really enjoy.
Actually, right now, we have over 100 volunteers from 6 different colleges in Mumbai, and it's amazing the kind of work that these college students do. The things that we're pretty creative, but they know Indian culture, they know what are the popular Bollywood movies, what are the popular songs.
So currently our mission statement is to empower students and slum residents to ensure that health is not limited by poverty. Even though we focus on water and sanitation and that is our focus, we want to be flexible enough in order to ensure that we're meeting the needs of the community, that we're not imposing our views and saying, this is what we believe you should work on. We want to make sure that there's that there is a partnership there and that we're able to do needs assessments and really work with what the community wants.